Hi, and welcome to the first episode of the You and I Today show, a talk show that aims to bring out the best of what humanity has to offer. And I'll be hosted by two lifelong and opinionated friends, with yours truly, Kelvin Simmons and Ryan Susiraj. Ryan, say hi.
Hi.
And every week we aim to bring in an expert in their own particular field that aligns to the season of the show. In the first season of the You and I Today show, we will be focusing on health with a particular emphasis on the impact of COVID-19. Now, before we introduce you to the guests of our show, just a friendly, gentle reminder to all our users and viewers out there to be acquainted and accustomed with the terms and use and privacy policy of our website and our social media sites as well. Okay, so to kick off the first episode of the You and I Today show, we have Sangeetha Siniah, who is a pediatrician, and she's specializing in infectious disease and immunology. So that's a mouthful, but we'll bring her in and we'll let her introduce herself to all our viewers. Sang, thank you for being with us here today.
Like you mentioned, I am actually just a general pediatrician first. I work in a local government hospital in Malaysia. So I'm actually currently pursuing a fellowship in infectious diseases and child immunology. So what I do is I actually take care of children who are born with a defect in their immune system. So that's going to be my main focus of my fellowship.
How do we deal with children who are suffering from COVID-19? Not even talking about those who have immunocompromised health systems, right? How do we deal with children just within the pandemic?
Not to downplay COVID-19, but what is a little bit thankful is that children generally do quite well. So I'm just going to put a general statement. Okay, so of course there are probably certain groups of them who may not may be at a higher risk, but generally children they don't really develop a very high risk of an illness, and there's always a bit of a lesser death when it comes to children. So I'm going to start off with a positive note. Yeah. So.
And Sangeetha, if you don't mind, two questions, right? First is this is quite a kind of subjective word. Right? When you say children, what age group are we actually looking at? Well, that's the first question. Yeah.
So children, they start from babies. So from day 0 till right up to 18 years old. Yeah. So like what you say, I mean, that's really true. I mean, when they are, of course, at a higher, I mean, like, you know, when they are from babies, they have a higher risk. I mean, they're not just at a higher risk for COVID, they're at a higher risk for so many other illnesses as well.
Yeah.
So, you know, as they get older, because they can tell you a little bit more, so you're a little bit less worried.
Yeah.
Yeah. So.
And then the other note of you, you know, kind of a generalized thing, you said typically the children kind of get through it better, or they're not as, I can't remember the phrase you used earlier where you said, I think they generally ride it out a bit better. Is that because COVID isn't interested in children, or is it because they are built to kind of resist this thing a lot better, or because they're communicating better and the parents therefore help them better? Like, what is it that makes them kind of generally, like you mentioned, kind of just cope with this a bit better?
Okay, so like you know that COVID is a group of coronaviruses. So these group of coronaviruses have, I mean, COVID is just one of them. There's so many other types of coronaviruses, and they generally cause just a common cold in children. So even before this, and they do quite well. So I think from the latest studies and what has been told is just that because children have these receptors in their lungs, which are not well formed yet.
Okay.
So hence these make them slightly less susceptible to very severe illnesses.
So does that make it? Does that make the children or kids and toddlers more of carriers without symptoms or asymptomatic carriers, and does that play a part in you know,
Transmission.
Yeah, transmission to elders as well.
Yeah, so that's a good question. I mean, so generally what happens is, yeah, it is known that children, actually, or most of us, when we have the virus, it actually stays on in our throats. And children, probably because they move around a little bit more, they're a little bit more active. It's said that children harbor it slightly longer. So, like you pointed out, yes, there is a small chance that children, may not have the disease, just like a lot of other adults as well, may not have the disease, but there is a possibility for them to transmit the disease, especially when you're talking about in a pandemic, when the cases are numbers, the numbers are high. Yeah, there is a possibility.
And do they present, or the children, do they present similar symptoms to that of adults as well as senior citizens?
Yes. So naturally, when you're talking about symptoms, so the children, I mean, it's still about the same. So they have a little bit of cough, they have a little bit of sore throat and fever. And here we take a fever of more than 37.5 degrees. So, and they have all the other, like probably a little bit of diarrhea, a little bit of tummy ache. So those are the other, just like how when you have a common cold or you have a flu, yeah, so those are part of what children can have. Babies generally have, you need to take up some of the clues. So for instance, like, they are coughing profusely, they can't stop coughing, or they are coughing until they turn blue. Or for instance, they, for a child who usually cries and suddenly the child's not crying as much, or the child is sleeping too much. So these are certain clues that, you gotta, I mean, it's the same for a lot of other illnesses as well. But, these are the kind of clues that you need to keep an eye on. And if you're worried, you should bring them to seek medical attention immediately.
I think if I'm hearing it correctly, what you're saying is, for those of us who perhaps in other times would have said, I'm sure this is okay and we can give it a couple of days, don't do that. Deal with it, pick up the phone, speak to a doctor. When you say seek medical attention, it's get them to a doctor to kind of check it out for sure, correct?
Right.
Yeah.
Right. So if it's an urgent need, like, you need to go immediately, then you have to go immediately. I mean, if you think that, the child is still just having a mild, just a running nose, or, it depends on which part of the country you are.
Yeah.
And, just, in probably in certain states where there's a lockdown, it's not easy to just go off to the doctor. So,
say for example, if you're in the Southeast Asian parts of the world, like Malaysia, in times where your children are not big enough or old enough to actually tell you that they are not feeling well, say from the ages of maybe 1 to 2, is it imperative for parents to then know exactly what type of cues and distresses to take from the kids so that they can actually bring them for the appropriate treatment and care?
Yeah. So generally, I mean, there's always, whenever someone's having a fever, or I mean, because it's almost the same symptoms, right? Like as like I said, like a normal cold. So like what I've mentioned earlier, like those kind of symptoms. So it goes based on ages. So if you think that your child's not feeding enough, or not, or you think that the child may be a bit dehydrated, the urine is less, or the child is just feeling so tired and not his usual self, not playing as much. So these are small clues that you could take up and probably just bring earlier to see a doctor.
Yeah.
I mean, in terms of pandemic, it's going to be difficult to treat everyone or to even test everyone. But I think you need to assume that it could be.
Don't feel as a parent that you're overreacting. There's no too safe. If you're seeing these things, get medical help. But also, it is not a guarantee that if you see these things, your child has COVID. It is, if you see these things, get them to help so you can see if they do have it or not. I think the most important thing is we've all had colds. Our children have all had colds, where typically you might have dismissed it, saying, "Oh, just give them a bit of warm water, tuck them up, and give them some food, put them to bed." Don't automatically do that. Think about it a bit more. Think of the kind of things that Sangeetha's mentioned. Keep an eye out, and if anything feels uncomfortable, ultimately parents have an instinct. If you feel uncomfortable, get out the door and get someone to look at them and get that expert help.
You mentioned that you are first and foremost a pediatrician, and your area of interest would be immunology. So, would kids with compromised immune systems portray the same type of symptoms as healthy kids with COVID-19?
So I guess symptoms-wise, probably almost the same. But in terms of their response, generally people who are, I won't really use the word immunocompromised itself, I'll just use the word immunosuppressed, because immunosuppressed means like children who are undergoing treatment for cancer, children who are, using like very high doses of like maybe steroids for autoimmune diseases. And yes, the children who are immunocompromised as well. So there's actually a very big group of them who, these people who they can't mount an immune response. So these generally would come into a higher risk group, even for normal infections. So even with COVID, it's going to be the same. Even if there is a vaccine, this group of people, not all can receive a vaccine because the body cannot produce a response. So generally, these group of people will have to have extra precautions. They will have to be definitely much more careful than, the general pediatric public. So I guess that's something that, parents who have children with these immunosuppressed state, they need to keep an eye on this as well.
Have you treated or seen parents with kids who have immunosuppressed immune systems, and how do they go about actually, not even talking about treating COVID, but bringing them to a hospital where, there's a potential for them to contract viruses and bacteria all around them? Is this something you see on a daily basis, and how do you go about treating these kids?
Yeah, so generally, I mean, like we treat them like any other child. But of course, we always tell them, even when they're going home, we tell them that there is a higher risk for you to get infections. So make sure on a normal days, they wear masks. Even when they come to the hospital, they wear masks. We usually give them a separate ward. And, when they come, they're always prioritized. Like we tell them that, you can come in earlier. If you're having even a mild infection or a mild cold, you can just come in. Get yourself admitted, get yourself checked. So these group of children, I mean, they have like a higher risk for them to, they have a higher risk of getting infections, bad infections. So we generally tell them to come in earlier.
If your child is immunosuppressed or compromised, or is in that bucket of children, you're of course very afraid, pre-COVID even, to kind of take them into a hospital environment because of they're already at risk. They may turn up there to get treatment for, a cut knee and end up coming home with another disease. Whether it's true or not, you have that fear. And I think what you said, Sangeetha, there are precautions, and not to kind of, yes, be careful, but also take them in. They need help. But are there services? Of course, if you're wealthy and you're willing to throw a lot of money in it, of course there are services where the doctor can come to you. But that may not be something that's very accessible to a lot of people. Are there things that you know of that where someone could call up and say, look, my child is really, really in this position and I'm very afraid to kind of take them in. What should I do? Is there anything like that? And maybe someone on the other line can go, absolutely not, don't bring them in. These are the other alternatives. Is there something like that they can do? Because the last thing they should do is nothing. They should try and do something. Yeah.
I mean, if it is not an emergency, like it's just starting, or it's or let's say they're going to take some routine bloods, or so what they could do is they probably could call and make an appointment. So at least the doctors know that they're coming in. So they'll space out the timings.
Right.
So this also is important for normal children, and even in the pandemics, I think calling up, making an appointment, not just waiting in the waiting area. So if you, if you can, and I think most hospitals are actually doing this. I know in Malaysia they are. So what they're doing is they have, a separate timing for children who are coming in for routine vaccinations, and they have a certain timing for children who are being seen for cough, fever, and especially in the private practices. In the government hospitals, they have these screening areas where if you have COVID-like symptoms. We call them ILI, like influenza-like illness symptoms, like you have a cough, you have a sore throat, or you have a fever. Then they put you in a different zone. So I guess these are ways that it will help as well, because parents feel a little bit reassured that my child is well, and I don't want them contracting some other illnesses from the hospital. So yeah, these are ways that I think doctors are taking.
That's a superb piece of advice, Sangeetha.
So, Sang, we've been talking about what to do from a parent and caregiver perspective, right? But what about the kids? What about children, say for within the age group of 3 to 5? How are they looking at this from their perspective? When there's social distancing, they can't go to school, they can't go about and play in the park, and then when they have a cough, is this something that they are fearful of? How are they looking at this from their perspective?
It's something that a lot of people overlook, because they only look at the physical part and about the illness part of the illness. So I think, to be honest, I think it should be a developmentally appropriate approach. So meaning that based on their age group, you need to speak with the child very honestly, because you'll be very surprised at how much information, how much knowledge they have. And you'll be surprised at the questions they ask you as well. So as much as we are fearful, we are anxious, these children would have the same feelings as well. So I think what is really important is you need to find a really quiet time where you can sit and you can explain to them, in their own ages, ask them especially how much do they know, what do they know about COVID, what are they fearful about, because I'm sure they will have a lot of fears as well. Are they sad that they can't go on play dates? They can't go to school like normal. There's so many things that is happening in school, that they have to sit apart from their friends, they have to wear masks. I think the teachers are doing a great job. They are actually trying to enforce all these SOPs and all in most areas of the world. I think what you can do is probably you ask them, make it fun. Ask them, okay, so what would you do to keep the whole family safe? They are already wearing their masks, and probably when guests come to the house, they can distribute sanitizers, they can check their temperatures. It's like a game for them, so they don't feel so stressed about that. And I think you really have to sit down and speak to them. I think this is something that parents really need to spend a little bit more time on.
What if the child is, I don't know the phrase to use, but for example, already ailing from something like an autistic child who can't even communicate, say the things that you just said, like you can talk to him or her, but how does, what do you do in those kind of situations?
So I guess these are really, those, it's a whole different group of children. So what you can do is probably just make them really comfortable. And I think even during a lot of these MCOs and movement control orders in some places, they have actually taken autistic children and all into consideration, because some areas, you have times where only children who have special needs get to go out, because it's really impossible for parents to keep this group of children at home. It's really tough on the parents, it's really tough on the children. So I think having these dedicated times, dedicated places, just to allow children with special needs, children with autism, to just have some time for themselves, it really helps.
When a child is affected, so maybe I don't know when this kicks in, but when a child is affected, this child has either the symptoms, so they're not confirmed having COVID, they may just be having a cold. Children, as you know, have I think a tendency, adults as well, but children to fall into one or two things. Either get really, because of this knowledge you've talked about, they now feel, oh my God, I've got a disease, I'm this horrible person, could go into the very dark, kind of depressed mode of, oh, I might have COVID, I'm among them friends. And on the flip side of that, there might be the child who isn't affected, who's now in a position of trying to bully that child and say, hey, you've got COVID, hey, you've got, like, how does that, is there some, I mean, I don't think there's advice, like, what could we do as parents, maybe kind of keep an eye out for those things, but also how do we help with that? Because the child probably in some cases is not going to even know this is happening. The child who might have it feeling really down and depressed that he's a problem or he or she's a problem, and the child who doesn't have it who's now bullying the child that might have it.
Yeah. So I guess like again, education, awareness, I think like because we don't speak about these things, so children just think that it's okay to bully and it's okay to they don't understand what's happening because children being children, so I think again it's age appropriate. This, I guess this is where parents, even the school system, so like public, I think there should be places like such as our talk show, like where people actually tell them it's what exactly they are going through, what other children are going through. So it would be good if like even patients or children who had suffered from COVID, the bigger ones who come up and speak about it, about their experiences, right? So I mean, a lot of them won't because they are worried about the stigma, so I guess that would be the best way.
I think the way to kind of look at, just maybe if I can summarize a little bit, is it's not a you or I problem, and I'm not playing the name of the show. It is not the child's problem, the parent's problem. It's everyone suffering from this.
Right.
So when the child or the parent, when you see your child have it, don't try and give the child the same amount of love and attention as always. This is a problem that everyone, the whole family needs to rally around. It's the whole community that needs to rally around. So if you see bullying, don't go now attack the bully, because that's not solving anything either. It is try and lift the whole group up so that everyone's now dealing with the problem, as opposed to this is this child's problem or that family's problem. It is everyone's affected. The whole world is affected.
Okay, Sangeetha, we talked a lot about what parents can do to see and understand the cues that are coming from their kids, right? And then what they can practice in terms of physical distancing and wearing their mask and everything. So what happens though when you get there, So you take all the necessary precautions, you bring your kid to the hospital. What next? What do you expect next from a child's perspective as well as from a parent's perspective?
Okay. So again, it would depend. Like, I mean, I don't think everywhere you're going to get a COVID test. So because the tests are limited and they do make sure that you have the symptoms, or you have been in contact with someone who is COVID positive, or you have been in the area where there have been cases. So now it goes by those kind of criteria. So I guess if I mean, in two scenarios, if you do go in as just a normal patient and the doctor does suspect that you have COVID, so there will be this test that they need to do. It's called a RT-PCR test, where they take a sample from your nose as well as your throat. Yes, for children, I mean, it can be a very distressful kind of like an experience. So, of course, we have the parents holding the child, we have the healthcare workers taking the sample. So I guess what you can do, if the parents, if the child can understand, you could actually explain that, we have to do this just for a short while. You explain the procedure, you tell them what's going to happen, because at least you don't lie. You tell them, yes, there will be a little bit of pain, but once it's done, you won't feel the pain anymore. This is just like when you tell children that you're going to go in for a jab, for an injection. So you don't lie to them. You tell them, yes, there is going to be a little bit of pain, but once it's done, we can go back home. We can wait for the test results. So these are ways where you can just keep the child a little bit more in tune with what's going on. There will be probably doctors wearing all these PPEs, the healthcare workers wearing all these PPEs. So some children might be very scared. Telling the children that somebody is going to take your COVID sample, using the suit is also important, because children go in and they see, I mean, of course they usually just see a doctor in a lab coat and they start freaking out. And so what we could do is probably show them pictures beforehand if we can, show them pictures, because there's so many pictures online. We could show them, tell them that, these are the people who are going to take. They are just doctors. They're just wearing, a kind of like a disguise, just like how Spider-Man wears, Superman wears.
Yeah.
So, those are things that, they're superheroes in their own way.
Yeah.
So, you can just tell them in that way. So these are all children's psychology that you need to play with.
So it comes to the point of the show where it's, I think Calvin would like to call this the magic wand question, which is, with the exception of you wishing this pandemic disappeared or never existed, and everyone who suffered from it didn't suffer from it, with the exception of that, because I presume that would be your number one wish. If you had a magic wand to wish everyone something, everyone who's affected, not affected, in relation to your field, in relation to the children, like what would you, and you can't ask for more magic wands, right? You only have one. What would you like to do?
I probably would say if I had one magic wand, I would just wish that every parent vaccinate their child. So this is not because in terms of COVID, because we know that children who are at a higher risk of infections are those who are not vaccinated as well.
Right.
So, because COVID itself, yes, you do get COVID, but a lot of times we see children who have COVID and other illnesses, or other illnesses causing the child to be more sick, and they get COVID. So it's like a double-edged sword. So I think that, my one advice to parents is never forget your vaccination, right? Apart from everything else, never forget your vaccination. The child has to have a balance, physical and mental health, as well as nutrition. So don't forget their mental health, because I think it's really important, right? So a lot of emphasis is on their physical health. So, but not on their mental health.
Yeah.
And so that's something that I wish parents would really look into.
And just to be clear, Sangeetha, it's when you say vaccination, it's not a vaccination against COVID-19, because that doesn't exist. It is vaccinations in general will just lower, just keep, right? I think that's the point you're making.
So, if they have not taken their yearly flu jabs, this would be a good time to do it, because those jabs in Malaysia are optional. It's not given as part of the national immunization program.
Thank you so much for being with us here. I know, I know for one, me and Ryan have learned so much more just by being in this segment with you. So that's the time we all have for you, our viewers. Thank you so much for joining us today, and thank you, Dr. Sinniah, for all the advice and excellent feedback you've given. Do follow us on www.uni.today. For all the resources and case notes that Dr. Sangeetha will be sharing with us. You can also follow us at Instagram, YouTube, Facebook, and TikTok at UNI Today. Thank you so much for joining us, and until the next episode.
Sangeetha, thank you for being on the show. But the reason you're on the show is all the other stuff you're doing outside the show. So people like you are the reason why this thing hasn't exploded more than it has. And I know in different parts of the world, you see people, like what's happening in the UK, you see at 8 o'clock every Sunday, everyone gets outside and claps. It's to acknowledge the health workers, right? Yeah. And the thing is, the health workers don't hear it because they're working. But the whole thing is, you are putting yourself at the front line so that other people can continue kind of carrying on.